Hello everyone, I'm Dr. Avani Ratan. I am a faculty at Conceptual Psychology and I'm here today to help you with the answer key of the M.Phil entrance exam of Government Medical College and Hospital. Soon after the discussion with me, we'll be joined by Dr. Praveen Tripathi sir, who is also faculty at Conceptual Psychology, and he'll help us with the questions of abnormal psychology. Starting with, the first question is that which of the following models emphasizes the influence of early childhood experiences on psychopathology? The options are A, the behavioral model, B, the cognitive model, C, the psychodynamic model, and D, the biopsychosocial model. So the correct answer here is the psychodynamic model. The psychodynamic model, it originates from Freud's psychoanalytic theory. It fundamentally emphasizes how the early childhood experiences, particularly those which are occurring in the first few years of life, they shape the personality development and they contribute to later psychopathology. So this model here, it possesses that the unresolved conflicts from early developmental stages can manifest as psychological symptoms in adulthood. Now, why are the incorrect answers not right? So the behavioral model, it focuses on the learned behaviors and environmental reinforcement patterns rather than the early childhood experiences. Here we are focusing more on the learned behavior. Then the cognitive model, it emphasizes the dysfunctioning thinking patterns and the cognitive distortions rather than the early experiences. The biopsychosocial model, it integrates multiple factors which include the biological, psychological and the social influences rather than specifically emphasizing on the early childhood. So the psychodynamic model, it uniquely emphasizes the lasting impact of early childhood experiences on adult mental health, which forms the foundation for psychodynamic therapies as well. So here in the biopsychosocial model, there is an integration of biological, psychological, and the social influences. So I hope the first answer is clear. The second question, what is the primary characteristic of a diathesis stress model? A, emphasizing unconscious conflicts. B, interaction between genetic vulnerability and environmental stress. C, solely attributing mental illness to social factors. And D, only considering the biological factors. So the correct option here would be B, which is the interaction between genetic vulnerability and environmental stress. Why is this the correct option? Because the diathesis stress model is a psychological theory that explains the development of mental disorders through the interaction of the predisposing vulnerabilities, right? Here we are looking at the predisposing vulnerabilities, which are known as the diathesis. So these can be genetic, these could be biological, or these could be psychological and even the environmental stressors. So this model suggests that neither vulnerability alone nor stress alone is sufficient to cause psychopathology. Rather, it is their interaction that triggers the onset of mental illnesses, right? So stress alone itself cannot be the factor, but rather the interaction of it with the vulnerabilities causes mental illnesses. Now, Emphasis on the unconscious conflicts. This is the characteristics of psychodynamic models. So here, this is rather the characteristic of a psychodynamic model instead of the diathesis stress model. Solely attributing mental illness to social factors. So this would be a purely social model, not a diathesis stress model, right? So this is where we are looking at only the social factors. So it's a social model instead of a diathesis stress model. Only considering the biological factors, this would purely be a biological model, right? So mental disorders, they result from the interaction between the predisposing vulnerabilities and the environmental triggers, not from a single factor alone. Hence, B is the correct option. The third question, it says, which of the following is not a component of Beck's cognitive triad? A. Negative view of self. B. Negative view of the world. C. Negative view of past. And D. Negative view of the future. So here the correct answer is C, which is negative view of the past. So Beck's cognitive triad, it consists of three components that characterize the thinking patterns of depressed individuals. The first is the negative view of self. Right here, the first is the negative view of self. The second is the negative view of the world. Negative view of the world. And the third is the negative view of the future. So, the triad does not include a negative view of the past as a core component, though past experiences may influence these three perspectives as well. Right? So, the negative view of self is one of the core component where a person thinks I'm worthless. It is a core component where a person thinks that I'm worthless. Then the negative view of the world is again a core component where the world is hostile or demanding. And then the negative view of future is again a core component where things will never get better. That is the kind of thinking. Things will never get better. So, Beck's cognitive triad, it focuses on the present self-perception, current worldview, and future expectations as the core cognitive distortions in depression. Moving on. In research methodology, which type of validity ensures that the test measures what it intends to measure? A. Content validity. B. Face validity. C. Criterion validity. And D. Construct validity. So here the correct answer is D, which is construct validity. Why? Because it refers to the degree to which a test measures the theoretical construct or concept it claims to measure. Okay, so it's the most comprehensive form of validity which encompasses whether the test truly captures the intended psychological construct rather than something else. Here, the construct validity is the correct answer because it measures the degree to which a test measures the theoretical construct. Why content validity is the incorrect answer? Because that ensures the test covers all aspects of the construct being measured. Here, all aspects of the construct are being measured. Then what is face validity? It refers to whether the test appears to measure what it claims. Here, the test appears to measure what it claims. Then there is criterion validity, which measures how well the test correlates with the established criteria or outcomes. How well the test correlates with established criteria or outcomes. So, construct validity is the fundamental question of whether your measurement tool actually measures the psychological concept you think it does. Hence, D is the correct answer. Moving on, which statistical test is appropriate for comparing means between two independent groups? Chi-square test, ANOVA, t-test, or regression analysis? So here the correct answer is C. It's a t-test. So the independent samples t-test is specifically designed to compare the means of two independent groups to determine if there is a statistically significant difference between them. So this test, it assumes that normal distribution and equal variances between the groups is there. Okay. So why is the chi-square test not the correct answer? Because it is used for categorical data and testing associations, not comparing means. Right. So here the chi-square is used for categorical data and it is also used to test associations, but it is not used to compare means. Now, ANOVA, why is that the incorrect answer? Because it is used for comparing means for 3 or more groups, right? So here 3 or more groups. Regression analysis, it is used to examine the relationship between variables and to predict outcomes. Relationship between variables and to predict outcomes. So the t-test is the gold standard for comparing means between two independent groups in psychological research. Hence, C is the correct answer. Now, the probability of rejecting a true null hypothesis is known as type 1 error, type 2 error, confidence interval, or standard deviation. So the correct answer is A, type 1 error. So type 1 error, denoted by this, it occurs when researchers reject a null hypothesis that is actually true, right? When you reject a null hypothesis which is actually true. Alright, so essentially finding a significant effect when none exists. So this is also known as a false positive. So this is also known as a false positive. So the probability of a type 1 error is typically set at 0.05 in psychological research, right? This is the probability which is set at 0.05. Now, what is a type 2 error? When you fail to reject a false null hypothesis, right? Here, failing to reject a false null hypothesis is a type 2 error, which is a false negative. What is a confidence interval? It is the range of values likely to contain the true population parameter. Range of values which is likely to cover the true population parameter. And standard deviation, it is a measure of variability in a data set. Measure of variability in a data set. Okay, so type 1 error represents the risk of concluding there is an effect when there isn't one, which is like the false alarm of statistical testing. Alright, moving on. Which of the following tests is primarily used for assessing frontal lobe functioning? Wisconsin card sorting test, Wechsler memory scale, Bender-Gestalt test, or Ray-Ostrich complex figure test? Okay, so here the correct answer is Wisconsin card sorting test. And why? Because it is specifically designed to assess the executive functioning, particularly the cognitive flexibility, the working memory, and the ability to adapt to changing rules. So, all functions which are primarily mediated by the frontal lobes, especially the prefrontal cortex. Alright, so that is the correct answer. The Wechsler memory scale, it assesses various types of memory functioning, as the name suggests, right? The Bender-Gestalt test, it assesses the visuomotor integration and perceptual skills. The Ray-Ostrich complex figure test, it is used to assess the visuospatial skills and memory. So here, this is for visuospatial skills and memory. Hence, the Wisconsin card sorting test, it is the gold standard neuropsychological test for evaluating the frontal lobe executive functioning. Moving on, the MMPI-2 is primarily used to assess A. Intelligence, B. Personality traits and psychopathology, C. Neuropsychological deficits, and D. Emotional intelligence. The correct answer is B. Personality traits and psychopathology. So, the Minnesota Multiphasic Personality Inventory 2, the MMPI 2, is a comprehensive psychological assessment tool which is designed to evaluate the personality characteristics and to identify various forms of psychopathology. So, it contains multiple clinical scales and validity scales which assesses the mental health conditions and personality traits. Now, intelligence is assessed by tests like the Wechsler Adult Intelligence Scale or the Stanford Binet tests, right? Or the neuropsychological deficits, they are assessed by specialized neuropsychological batteries. And the emotional intelligence is assessed by specific emotional intelligence measures. So the correct answer here is the MMPI-2. It is the most widely used standardized test for assessing personality and detecting psychopathology in clinical settings. Next, the Wechsler Adult Intelligence Scale 4 measures which of the following cognitive abilities? A. Verbal comprehension, perceptual reasoning, working memory and processing speed. B. Emotional intelligence, memory and executive functioning. C. Personality traits and problem solving skills. And D. Sensory motor integration and coordination. The correct answer is A. Okay, so the Wechsler Adult Intelligence Scale 4 is organized into 4 primary index scores. One is Verbal Comprehension Index, which is in short known as VCI. Then there is perceptual reasoning index. Then there is the working memory index and processing speed index. So these four domains, they provide a comprehensive assessment of adult intellectual functioning. All right. So B, which is emotional intelligence, memory and executive functioning. These are not the specific domains which are measured by the Wechsler Adult Intelligence Scales. Then, of course, personality traits and problem solving skills are not measured because it focuses on cognitive abilities, not personality. Then the sensory motor integration and coordination, these are not the primary focuses of WAIS 4. So the WAIS 4, it provides a comprehensive assessment of adult intelligence through four key cognitive domains, which we just mentioned right now. Hence, A is the correct answer. Which psychological test is used to assess attention deficits in children? Wisconsin's card sorting test, Corner's continuous performance test, Minnesota multiphasic personality inventory, Beck depression inventory. So the correct answer is B. Corner's continuous performance test. So this is specifically designed to assess sustained attention. This assesses sustained attention and response inhibition in children and adolescents. It is commonly used in the diagnosis and monitoring of ADHD by measuring attention related performances over time, right? This helps aid in the diagnosis of ADHD. Now, the Wisconsin card sorting test, it assesses the executive functioning and cognitive flexibility. Here we are looking at executive functioning and cognitive flexibility. The Minnesota Multiphasic Personality Inventory, as the name suggests, it's an adult personality assessment tool. And Beck Depression Inventory assesses depressive symptoms, not attention. Okay, so the Corners CPT is the gold standard computerized test for objectively measuring attention and response inhibition in children. Moving on. Which of the following is a core principle of cognitive behavioral therapy? Free association, identifying and modifying dysfunctional thoughts, dream analysis, unconscious conflict resolution. So, the correct answer is B. So CBT, it is fundamentally based on the principle that psychological distress, it results from maladaptive thinking patterns and behaviors. So the therapy focuses on identifying, examining and modifying the dysfunctional thoughts and beliefs to improve the emotional and behavioral outcomes. Hence, B is the correct answer. Free association is a psychoanalytic technique. It is not a part of CBT. Dream analysis is another psychoanalytic technique not used in CBT, and unconscious conflict resolution is the focus of psychodynamic therapy, not CBT. So, CBT's effectiveness lies in its systematic approach to identify and change the maladaptive thought patterns that contribute to the psychological distress. Hence, B is the correct answer. Moving on. In exposure therapy for anxiety disorders, the patient is A. Gradually exposed to the feared stimulus in a controlled manner. B. Taught to suppress anxious thoughts. C. Encouraged to avoid anxiety provoking situations. And D. Given medication to reduce anxiety before exposure. So, here the correct answer is A, where the patient is gradually exposed to the feared stimulus in a controlled manner. So here, exposure therapy, it is based on the principle of habituation and extinction learning, right? So patients are systematically and gradually exposed to anxiety-provoking stimuli in a safe, controlled environment, which allows them to learn the feared situation is not actually dangerous, and it reduces their anxiety response over time, right? So here, the principle of habituation and extinction is used. Okay, now when we talk about teaching them to suppress anxious thoughts, this is not the mechanism of exposure therapy and it may be counterproductive. It's the wrong choice. Or encouraging them to avoid anxiety provoking situations, again this would maintain or worsen their anxiety through negative reinforcement, the wrong choice. Given medication to reduce anxiety before exposure, while sometimes it is used as an adjunct therapy, this is not the primary principle. So exposure therapy, it works through controlled gradual confrontation with feared stimuli to achieve habituation and extinction of the anxiety responses. Now, which type of therapy focuses on the client's capacity for self actualization? Cognitive therapy, humanistic therapy, behavioral therapy, or psychoanalysis? So, the correct option here is B. So, humanistic therapy, it was developed by Carl Rogers and Abraham Maslow. So, it emphasizes that the individual's inherent capacity for self-actualization, for personal growth and positive change, right? So, it focuses on the client's potential for self-improvement and reaching their full potential as a human being. So, hence, humanistic therapy is the correct answer. Now, cognitive therapy, it focuses on changing the dysfunctional thinking patterns. Behavioral therapy would focus on changing the maladaptive behaviors through learning principles. Psychoanalysis focuses on the unconscious conflicts and the early childhood experiences. Hence, these are the incorrect options. So, humanistic therapy, it uniquely emphasizes human potential for growth and self-actualization rather than pathology or dysfunction. Now, which of the following therapeutic approaches emphasizes modifying maladaptive behaviors through reinforcement? Psychoanalysis, cognitive therapy, behavior therapy, or humanistic therapy? So it is pretty easy. The answer is behavior therapy. Behavior therapy, it is based on the principles of operant and classical conditioning, right? It uses reinforcement. It also uses punishment and extinction to modify the maladaptive behaviors. So it systematically applies learning theory principles to change the problematic behavioral patterns. So here, learning theory principles are used to change the maladaptive behaviors. Okay, psychoanalysis on the other hand focuses on the unconscious conflicts and insight development. Cognitive therapy primarily focuses on changing the thought patterns rather than direct behavior reinforcements. Humanistic therapy, it focuses on self-actualization and personal growth. Hence, C is the correct answer because behavior therapy directly applies learning principles, especially the reinforcement strategies to systematically modify the problematic behaviors. Now, dialectical behavior therapy, DBT, was originally developed for treating which disorder? Major depressive disorder, schizophrenia, borderline personality disorder, or generalized anxiety disorder. So, here it was used to treat BPD. So, DBT, it was specifically developed by Marsha Linehan for treating individuals with borderline personality disorder, particularly those with chronic suicidal behaviors. and it combines CBT techniques with mindfulness and distress tolerance skills to address the emotional dysregulation, which is the characteristics of BPD. So here we are looking at the emotional dysregulation. Which is the characteristic hallmark trait of BPD. Major depressive disorder. So while DBT can be adapted for depression, it wasn't originally developed for this. Schizophrenia, not the original target population for DBT. Generalized anxiety disorder, again, this was not the focus for DBT. So DBT was specifically created to address the complex emotional and the behavioral challenges of borderline personality disorder. Now, which therapy technique involves identifying and challenging irrational beliefs? REBT, client-centered therapy, psychoanalysis, or gestalt therapy? So the correct answer is rational emotive behavior therapy, REBT. So here REBT was developed by Albert Ellis, and specifically it focuses on identifying and challenging irrational beliefs that lead to emotional disturbances. Okay, so it uses the ABC model, which is activating event, belief, and consequence. It's based on the ABC model. So it uses the ABC model to help the client recognize and dispute their irrational beliefs. Now, client-centered therapy, it focuses on providing unconditional positive regard and it facilitates self-exploration. Psychoanalysis focuses on the unconscious conflicts and the early experiences. Gestalt therapy, it focuses on the present moment awareness and its integration. So, REBT specifically targets the irrational beliefs as the root cause of emotional disturbance using systematic disputation techniques. Alright. Now, in psychodynamic therapy, which defense mechanism involves attributing one's own unacceptable feelings to others? Projection, repression, sublimation, and displacement. Correct answer is projection. So, projection is a defense mechanism where individuals attribute their own unacceptable thoughts, feelings, or impulses to others. So, this allows them to avoid the awareness of these uncomfortable aspects of themselves while they are still expressing them indirectly. So, hence, projection is the right answer. What does repression mean? Repression is unconsciously pushing the unacceptable thoughts out of the awareness. Pushing unacceptable thoughts out of awareness. Sublimation, it is channeling the unacceptable impulses into socially acceptable activities. Here you are channeling the unacceptable impulses in socially acceptable activities. Displacement is redirecting the emotions from the original target to a safer substitute. So, projection involves seeing your own unacceptable qualities in others rather than acknowledging them in yourself. Hence, this is the correct answer. What is the main goal of existential therapy? resolving unconscious conflicts, enhancing self-actualization, finding meaning in life, or modifying the maladaptive behaviors. So here the correct answer is finding meaning in life. So existential therapy, it is influenced by philosophers like Sartre and psychologists like Viktor Frankl, and it focuses on helping clients find meaning and purpose in their lives. So they confront the existential concerns about death, about freedom, about responsibility, and create the authentic ways of being. So the first, resolving unconscious conflict, it is a goal of psychodynamic therapy. Enhancing self-actualization, it is more specific to humanistic therapy. Modifying maladaptive behaviors is a goal of behavior therapy. So, existential therapy, it addresses the fundamental questions about meaning and purpose of human existence. Now, which psychologist is known as the father of modern psychology? Here, it's William Wundt. So, William Wundt, he established the first psychology laboratory in Leipzig, Germany in 1879, which marked the formal beginning of psychology as an experimental science, which is separate from philosophy. So, he pioneered the use of controlled experimentation in psychological research. Now, Sigmund Freud, what did he do? He founded psychoanalysis, but came after Wundt's establishment of psychology as a science. Carl Rogers, his name is important when you talk about humanistic psychologists, but he's not the founder of the field. B.F. Skinner, so important behaviorist, but not the founder of psychology. Hence, Wundt established the first psychological laboratory, which marks psychology's birth as an independent scientific field. Hence, B is the correct answer. Moving on, what is the primary focus of applied psychology? Theoretical concepts, experiments, practical application in real world settings, or research methods? So, here the primary focus of applied psychology is the practical application in real world settings. C is the correct answer. So, applied psychology, it focuses on using psychological principles, theories, and even the findings to solve the practical problems, and it improves the human welfare in real world settings, such as maybe in a clinical practice, maybe in education, maybe in community interventions, and even in businesses. Okay. So, the theoretical concepts here is a wrong answer because it is more of a characteristics of a basic or academic psychology. Experiments, while they're very important, the focus is on applying findings rather than conducting experiments. Research methods, here it is an important tool, but it is not the primary focus. So, the applied psychology, it bridges the gap between psychological science and practical problem solving in everyday life. C is the correct answer. Moving on. What is the primary focus of acceptance and commitment therapy, ACT? So, here, challenging irrational beliefs, suppressing negative emotions, developing psychological flexibility, or exploring unconscious conflicts. So, here the correct answer is C, developing psychological flexibility. So, acceptance and commitment therapy, it focuses on developing psychological flexibility, which is the ability to adapt behavior to match the personal values and goals, even in the presence of difficult thoughts, difficult feelings, or sensations. So this involves acceptance of internal experiences rather than trying to control or eliminate them. All right. Now, challenging irrational belief is more a characteristic of CBT rather than ACT. Suppressing negative emotions is opposite of ACT's acceptance based approach, hence it's the wrong answer. Exploring the unconscious conflicts is again psychodynamic psychotherapy. So ACT, it emphasizes psychological flexibility, the ability to act according to the values despite difficult internal experiences. Which technique is commonly used in motivational interviewing? Free association, reflective listening, exposure therapy, or systematic desensitization? Correct answer is reflective listening, because it is a core technique in motivational interviewing where the therapist reflects back what the client has said while demonstrating understanding and helping the client explore their own motivations for a change. So this non-confrontational approach, it helps build the rapport and it facilitates the client's self-reflection. Now free association here is the incorrect answer. Why? Because it is a psychoanalytic technique. Exposure therapy, it is a behavioral technique. Systematic desensitization, it is behavioral technique for phobias. So reflective listening in motivational interviewing, it helps the client explore their own motivations for change in a supportive and in a non-judgmental and non-confrontational manner. Hence B is the correct answer. Now, which therapy is most effective for obsessive compulsive disorder? Psychoanalysis, CBT, client centered therapy, or gestalt therapy? So, the correct answer is CBT with exposure and response prevention. This is the gold standard psychological treatment for OCD. ERP involves exposing the patients to situations that trigger the obsessions while preventing the compulsive responses, which leads to habituation and reduction in the OCD symptoms. All right. The psychoanalysis here is not advised because that is not empirically supported for OCD treatment. Client centered therapy, not specifically effective for OCD. Gestalt therapy, not empirically supported for OCD. So, ERP is the most effective psychological intervention for OCD. It works through exposure and prevention of compulsive behavior. Hence, B is the correct answer. Now, which of the following is not a key element of dialectical behavior therapy? Mindfulness, interpersonal effectiveness, dream analysis, and emotion regulation. It's very easy. It's dream analysis. So DBT, it consists of 4 key modules. One is mindfulness, other is interpersonal effectiveness, third is emotional regulation, fourth is distress tolerance. So dream analysis is a psychoanalytic technique and it is not a part of DBT's structured approach to treating borderline personality disorder. So mindfulness is again a core DBT skill which focus on being present in the moment. Interpersonal effectiveness, again a core DBT skill for managing relationships. Emotional regulation, core DBT skill for managing intense emotion. So the 4 modules, mindfulness, interpersonal effectiveness, emotional regulation, and distress tolerance, do not include the psychoanalytic technique like dream analysis. Okay, moving on. In which therapy approach is the miracle question commonly used? Solution focused brief therapy, cognitive therapy, existential therapy, or psychodynamic therapy? The correct answer is solution focused brief therapy. So, here the miracle question. I'll give you an example. Suppose a miracle occurred overnight and your problem was solved. So, this is a signature technique of solution focused brief therapy. It helps the clients envision their preferred future and identify the goals and resources for the change. All right. Cognitive therapy, it uses techniques like thought records and cognitive restructuring, hence, this is not the right answer. Existential therapy, it focuses on meaning making and existential concerns, hence, not the right answer. Psychodynamic therapy, it uses techniques like interpretation and transference analysis. So, the miracle question, it helps the clients in SFBT envision the solutions and identify the concrete goals for positive change. Hence, A is the correct answer. Next question. Which of the following is a key component of trauma focused CBT? Exposure to traumatic memories, free association, dream interpretation, or systematic desensitization? A. So the trauma focused CBT, it includes the gradual therapeutic exposure to traumatic memories, and it reminds to help process the trauma. It reduces avoidance and it decreases the PTSD symptoms. So this exposure is conducted in a very safe, controlled therapeutic environment. So here, free association is a psychoanalytic technique. Dream interpretation is again a psychoanalytic technique. Systematic desensitization is used for phobias, not trauma-focused CBT. So hence, the therapeutic exposure to traumatic memories is essential in trauma-focused CBT to promote the processing and to promote recovery. Okay, which therapy technique involves challenging cognitive distortions? First is behavioral activation, second is mindfulness meditation, third is cognitive restructuring, and fourth is flooding. So here the correct answer is cognitive restructuring. So cognitive restructuring, it is a core CBT technique that involves identifying, examining and challenging the distorted or the unhelpful thinking patterns, and it helps replace them with more balanced or realistic thoughts. Okay. Behavioral activation, it focuses on increasing the positive activities to improve the mood. So mindful meditation is where you focus on the present moment awareness and you accept it. Flooding is an exposure technique which is involved in intense exposure to the feared stimuli. So, cognitive restructuring, it systematically challenges and modifies the distorted thinking patterns that contribute to emotional stress. Hence, C is the correct answer. Now, which therapy technique is based on the concept of unconditional positive regard? Psychoanalysis, client centered therapy, behavioral therapy, or gestalt therapy? The correct answer here is client centered therapy. So, here, unconditional positive regard is a core concept in Carl Rogers' client centered therapy, where referring to the therapist's complete acceptance and support for the client, regardless of what they say or do, creates a safe environment for self exploration and for growth. Psychoanalysis, it focuses on the interpretation and insight rather than unconditional positive regard. Behavioral therapy focuses on behavior change through conditioning principles. Gestalt therapy, it focuses on the present moment awareness and its integration, right? So, unconditional positive regard, it creates a therapeutic environment of complete acceptance that facilitates the client's self exploration and growth. Hence, B is the correct option. Now, which of the following is an essential component of mindfulness based cognitive therapy MBCT? Challenging automatic thoughts, enhancing self awareness and acceptance, encouraging free association, and interpreting unconscious conflicts. So, here the correct answer is enhancing self awareness and acceptance. So MBCT, it combines mindfulness meditation practices with cognitive therapy principles to enhance your self-awareness and acceptance of thoughts and feelings without any judgment. This helps prevent the depressive relapse by changing the relationship to negative thoughts rather than changing the thoughts themselves. Alright, challenging the automatic thoughts is the traditional CBT. Encouraging free association is a psychoanalytic technique. Interpreting the unconscious conflicts is a psychoanalytic approach. So MBCT, it uses mindfulness to develop a different relationship with these thoughts and feelings through awareness and through acceptance. Hence B is the correct answer. Now, which therapeutic approach was developed by Fritz Perls? Gestalt therapy, cognitive behavioral therapy, rational emotive behavior therapy, or dialectical behavior therapy? The correct answer here is A. So Fritz Perls developed Gestalt therapy, which emphasizes the present moment awareness. It also emphasizes on the personal responsibility and the integration of different aspects of the self. Here, the therapy focuses on here and now. And it helps the clients to become aware of how they interrupt their natural processes. B is cognitive behavior therapy. It was developed by Aaron Beck and others. So this is not the correct answer. REBT, we just studied. It was developed by Albert Ellis. Dialectical behavior therapy was developed by Marsha Linehan. So Gestalt therapy, which was developed by Pearls, it emphasizes the present moment awareness and integration of the fragmented aspects of your personality. Moving on. In cognitive therapy, which cognitive distortion involves interpreting ambiguous situations negatively? A. Catastrophizing, B. Overgeneralization, C. Personalization, and D. Selective abstraction. So the correct answer is selective abstraction. So this is also known as mental filtering. This is also known as mental filtering. So it involves focusing exclusively on the negative aspects of a situation while ignoring the positive elements, which leads to consistently negative interpretation of the ambiguous situations. What is catastrophizing? Where you are expecting the worst possible outcome. Overgeneralization, where we draw broad conclusions from single events. Personalization, taking excessive responsibility for negative events. Hence, selective abstraction, it involves filtering out the positive information and focuses only on the negative aspect of the situation. Hence, D is the correct answer. Now, which technique is not commonly used in psychoanalytic therapy? Free association, dream analysis, cognitive restructuring, or transference interpretation. So, here cognitive restructuring is the correct answer. So, cognitive restructuring is a CBT technique which is focused on changing thinking patterns. It is not a part of traditional psychoanalytic therapy that emphasizes on the unconscious processes or on the free association or on the dream analysis and the transference interpretation, right? So, free association is a core psychoanalytic technique. So is dream analysis and so is transference interpretation. So psychoanalytic therapy, it uses insight oriented techniques rather than direct thought changing approaches for cognitive therapy. Hence C is the right answer. Now, in behavioral therapy, systematic desensitization is used primarily to treat depression, phobia, schizophrenia, or bipolar disorder. B. Systematic desensitization is specifically designed to treat phobias and anxiety disorders by gradually exposing the individuals to the feared stimuli while they are in a relaxed state, which helps them overcome their fear through counter conditioning. Okay, so depression is more effectively treated with CBT or behavioral activation. Schizophrenia, it requires antipsychotic medication and psychosocial interventions. Bipolar disorder requires mood stabilizers and psychoeducation. So here the correct answer is phobia. Okay. Which of the following therapies is most effective for treating PTSD? Psychoanalysis, trauma focused CBT, humanistic therapy, or existential therapy? So here the correct answer is B. So, trauma focused cognitive behavioral therapy is considered the gold standard treatment for PTSD, which incorporates exposure therapy. It also incorporates cognitive restructuring and coping skills training to help individuals process the traumatic events. Now, psychoanalysis, it is not empirically supported as the first line treatment of PTSD. Humanistic therapy is also not specifically designed for trauma treatment, and existential therapy is also not empirically supported. So, the correct answer here is B. Moving on. What is the main focus of interpersonal therapy? IPT. Resolving unconscious conflicts, improving social and communication skills, exploring past trauma, and developing mindfulness skills. So, the correct answer is improving social and communication skills. So, IPT, it focuses on improving interpersonal relationships and social functioning by addressing four main problem areas. First is grief. Second is interpersonal disputes. Third is role transitions. And fourth is interpersonal deficits. So here it emphasizes communication skills and the relationship patterns. Now, resolving unconscious conflicts, psychodynamic therapy, wrong answer. Exploring past trauma, it is more the characteristic of trauma focused therapy. Developing mindfulness skills, it is characteristics of mindfulness based therapies. Hence, IPT specifically targets the interpersonal problems and communication skills to improve mental health through better relationships. Now, which of the following is a core skill taught in DBT? Mindfulness, free association, dream analysis, or aversion therapy? Correct answer is mindfulness. It is one of the four core skill modules in DBT. It focuses on developing present moment awareness and non judgmental observations of thoughts, feelings, and sensations. It forms the foundation for the other DBT skills as well. Free association, dream analysis, both are psychoanalytic techniques. Aversion therapy is behavioral technique not used in DBT. Hence, mindfulness is the foundational skill in DBT that supports the emotional regulation and distress tolerance. The primary goal of REBT is to modify irrational beliefs, analyze childhood experiences, encourage catharsis, or use dream interpretation. The first answer is the correct answer. So, REBT's primary goal is to identify and modify irrational beliefs that lead to emotional disturbance and maladaptive behaviors. It uses the ABC model, which helps the clients understand how beliefs about events rather than events themselves cause the emotional problems. Okay. So, analyzing childhood experiences, it is a focus of psychodynamic therapy. Encouraging catharsis more is a characteristics of gestalt or psychodynamic approaches. Using dream interpretation is again a psychoanalytic technique. So, REBT specifically targets the irrational belief as the root cause of emotional disturbance and behavioral patterns. So, A is the correct answer. Which therapy is most effective in treating OCD? Psychoanalysis, exposure and response prevention, gestalt therapy, or humanistic therapy? The answer is very easy, plain and simple. It is exposure and response prevention, which is the specific CBT technique that is more effective for OCD. It involves the exposing patients to situations which trigger the obsessions while preventing them from engaging in the compulsive behaviors, which leads to habituation and symptom reduction. All right, so here the principles of habituation and extinction are used for symptom reduction. Psychoanalysis, gestalt therapy are not empirically supported for OCD, and humanistic therapy was not even designed to cater to OCD. Okay, so ERP is the gold standard behavioral intervention for OCD, which works through exposure and prevention of complex responses. Okay. Now, cognitive distortions are a key focus in which therapeutic approach? CBT, existential therapy, psychodynamic therapy, or client centered therapy? So, the answer is CBT. It's the correct answer. So, CBT specifically identifies and addresses cognitive distortions. Also, it identifies the systematic errors in thinking that contribute to the emotional distress and maladaptive behaviors. So, common distortions, which include the all or none thinking, which is also known as the black and white or the polarized thinking, the catastrophizing, overgeneralization, these are the examples of the distortions that the brain creates. Then, existential therapy, it focuses on the meaning and existential concerns. That is the incorrect answer. Psychodynamic therapy focuses on the unconscious conflicts and the early experiences. Client centered therapy focuses on the self acceptance and the personal growth. Hence, A is the correct answer. In family therapy, the term triangulation, it refers to A, strengthening communication between two family members, B, a third party being drawn into a conflict, C, establishing clear boundaries, and D, reducing stress through role playing. So here the correct answer is B, a third party being drawn into a conflict. So the triangulation occurs when two people in conflict involve a third party, which is unfortunately often a child, in their dispute to reduce the tension between themselves. So this creates an unhealthy family dynamics and can be harmful to the third party. Now, the strengthening communication between two family members, this would be a therapeutic goal. This is not triangulation. Establishing clear boundaries, this is a healthy family process, not triangulation. Reducing stress through role playing, this is a therapeutic technique, not triangulation. So, triangulation is a dysfunctional family pattern where conflicts between two people inappropriately involve a third party. Now, which of the following therapies is best suited for treating borderline personality disorder? Very easy by now. Dialectical behavior therapy. So, DBT was specifically developed for BPD and it is considered the standard treatment. It addresses the core features of BPD, which is emotional dysregulation, interpersonal difficulties, impulsive behaviors, and it caters to that through skills training in mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. All right. So CBT, it is helpful, but it is not specifically designed for BPD's complex presentation. Psychoanalysis is a long-term approach, but not as empirically supported for BPD. Behavioral activation is primarily used for depression, not BPD. So DBT's comprehensive approach specifically addresses the emotional dysregulation and the interpersonal difficulties, which are the characteristics of BPD. Okay. Now, which therapeutic approach was developed by Aaron Beck? Gestalt therapy, cognitive therapy, existential therapy, narrative therapy. The correct answer is cognitive therapy. So, Aaron Beck developed cognitive therapy, which focuses on identifying and modifying the dysfunctional thinking patterns and beliefs. So, Beck's approach, he emphasizes the relationship between thoughts, feelings, and behaviors, which are the foundation of modern CBT. Okay, Gestalt therapy was developed by Fritz Perls. Existential therapy was developed by various existential philosophers and psychologists. Narrative therapy was developed by Michael White and David Epstein. Hence, B is the correct answer. Now, the empty chair technique is commonly used in rational emotive behavior therapy, gestalt therapy, psychoanalysis, or behavioral therapy. So, here the correct answer is gestalt therapy. So, the empty chair technique, it is a signature intervention in gestalt therapy where clients have conversations with different aspects of themselves or maybe significant others, which is represented by an empty chair. So, this promotes the integration and the resolution of their internal conflicts. So, rational emotive behavior therapy, it uses disputation and logical analysis techniques. Psychoanalysis, it uses free association and interpretation. Behavioral therapy uses conditioning and reinforcement techniques. So, the empty chair technique in gestalt therapy, it facilitates dialogue with different parts of the self to promote integration and resolution. Hence, gestalt therapy, which is B, is the right answer. Now, a key characteristics of client-centered therapy is the therapist providing unconditional positive regard, the focus on past unconscious conflicts, direct interpretation of dreams, and challenging cognitive distortions. Here, A is the correct answer. So, unconditional positive regard is one of the core conditions in Carl Rogers' client centered therapy, along with empathy and genuineness. Okay, it involves complete acceptance of the client without any judgment. That means by creating a safe environment for self exploration and growth. Now, the focus on past unconscious conflicts, it is a characteristics of psychoanalytic therapy. Direct interpretation of dreams is also psychoanalytic technique. Challenging the cognitive distortions is CBT. So unconditional positive regard, it creates the therapeutic foundation for client self-discovery and personal growth in client-centered therapy. Now, which therapy focuses on helping clients find meaning in life despite the suffering? Existential therapy, behavioral therapy, psychoanalysis, or cognitive therapy? The correct answer here is A, which is existential therapy. So, existential therapy, it is influenced by Viktor Frankl's logotherapy, right? It emphasizes on helping clients find meaning and purpose in life, even in the face of unavoidable suffering. It addresses fundamental existential concerns about meaning, death, freedom, and even isolation. Okay. Behavioral therapy focuses on changing maladaptive behaviors. Psychoanalysis focuses on the unconscious conflicts and early experiences. Cognitive therapy focuses on changing the dysfunctional thinking patterns. So, existential therapy, it uniquely addresses the human search for meaning and purpose, particularly in the context of life's inevitable challenges. Hence, A is the correct option. In behavior therapy, reinforcement is used to encourage desired behaviors, identify unconscious motives, modify cognitive distortions, or develop insight into past trauma. So, here the correct answer is to encourage desired behaviors. Reinforcement, it is a fundamental principle of operant conditioning. So, this is the fundamental principle of operant conditioning, which is used in behavior therapy to increase the frequency of desired behavior, right? So now here what happens is that positive reinforcement adds something pleasant while negative reinforcement removes something unpleasant. Both are serving to strengthen the target behaviors. So what does positive reinforcement do? It actually helps in adding something pleasant. While negative reinforcement, what does it do is remove something unpleasant. So both are strengthening the target behaviors. Alright, so that's why first A is the correct answer. B is identifying unconscious motives, which is goal of psychodynamic therapy. C is modifying cognitive distortions, goal of cognitive therapy. D is develop insight into past trauma, which is goal of trauma focused or psychodynamic therapies. So reinforcement is the key mechanism in behavior therapy for systematically increasing the occurrence of adaptive behaviors. Moving on. Which therapy technique involves gradual exposure to a feared stimulus while practicing relaxation? Systematic desensitization, free association, thought stopping, psychoeducation. Okay, so here systematic desensitization is the correct answer. So systematic desensitization, it combines relaxation training with gradual exposure to increasingly anxiety provoking stimuli. Okay, so here what we are doing is combining relaxation training with gradual exposure to increasingly anxiety provoking stimuli. So the relaxation response becomes conditioned to the feared stimulus, which further reduces anxiety through the principle of reciprocal inhibition. Okay, free association here is a psychoanalytic technique which involves spontaneous verbalization of thoughts, hence it's the wrong answer. Thought stopping is a cognitive technique for interrupting the unwanted thoughts, and psychoeducation is when you provide information about mental health condition. Hence A, which is systematic desensitization, it uses counter conditioning to replace the anxiety responses with relaxation responses to the feared stimuli. Now, motivational interviewing is most commonly used to treat substance use disorders, schizophrenia, autism spectrum disorder, or ADHD. So, most commonly used for substance use disorders, because motivational interviewing was originally developed for treating substance use disorders and it remains the most commonly applied in addiction treatment till now. It helps to resolve the ambivalence about change and it enhances the motivation for recovery through collaborative client centered techniques, right? So here it resolves the ambivalence towards change. For schizophrenia, typically it is treated with antipsychotic medication and psychosocial rehabilitation. Autism spectrum disorder is treated with behavioral interventions and social skills training. ADHD is treated with medication and behavioral interventions. Okay, so motivational interviewing strength lies in helping the individuals resolve the ambivalence and build the motivation for behavior change, particularly in addiction. Moving on. Which of the following is a key component of acceptance and commitment therapy? Cognitive diffusion, interpretation of dreams, hypnosis, and free association. So, the correct answer is cognitive diffusion. It is a core acceptance commitment therapy technique that helps the individuals change their relationships with thoughts rather than changing the thoughts themselves, right? So it involves learning to observe thoughts as mental events rather than literal truths. It reduces their impact on behavior. Interpretation of dreams and free association are psychoanalytic techniques. Hypnosis is not the core of ACT technique. Hence, cognitive diffusion in ACT helps clients develop psychological flexibility by changing their relationships with difficult thoughts. Now, in a structural family therapy, the therapist aims to reorganize the family hierarchies and boundaries, explore early childhood experiences, focus solely on individual behavior, and encourage dream analysis. First, option A is the correct answer. So, in a structural family therapy, which was developed by Salvador Muniz, it focuses on reorganizing dysfunctional family structures, including the unclear boundaries, inappropriate hierarchies, and problematic coalitions between the family members. Now, why are the other options incorrect? When we talk about exploring early childhood experiences, these are more characteristics of a psychodynamic approach. Focusing solely on individual behavior, it contradicts the systemic focus of family therapy. Encouraging dream analysis, it is psychoanalytic technique not used in structural family therapy. So the structural family therapy, it addresses the dysfunctional family patterns by reorganizing structural elements like boundaries, hierarchies. Hence, A is the correct answer. Now, which therapy primarily focuses on increasing awareness of the present moment? A. The mindfulness based cognitive therapy. B. Psychoanalysis. C. Existential therapy. D. Solution focused therapy. So, the correct answer here is mindfulness based cognitive therapy. So, MBCT specifically integrates the mindfulness meditation practices with the cognitive therapy to develop the present moment awareness and acceptance. This helps the individuals observe their thoughts and feelings without automatically reacting on them. Psychoanalysis, it focuses on the past experiences and unconscious processes. Existential therapy focuses on meaning making and existential concerns. Solution focused therapy, here it focuses on future goals and solutions. So, MBCT, it uses mindfulness practices to develop the present moment awareness as a way to prevent depressive relapse and manage difficult emotions. Question 57. The type of thinking in which a person starts from one and comes up with many different ideas is an example of divergent thinking, convergent thinking, critical analysis, and decision. So, here the correct answer is divergent thinking. So, divergent thinking, it involves generating multiple creative solutions or ideas from a single starting point. So, here multiple solutions or ideas from a single starting point. So it is characterized by flexibility, fluency, and originality in thinking, and it is often associated with creativity and problem solving. What is convergent thinking? It involves narrowing down multiple ideas to find the single best solution. Here we are narrowing down multiple ideas for single best solution. The critical analysis, it involves the systematic evaluation and judgment of information, and decision is the process of choosing between alternatives. Hence, divergent thinking, it is the creative process of generating multiple possibilities and solutions from a single starting point. Hence, A is the correct answer. Behavioral activation is primarily used to treat depression, schizophrenia, PTSD, or phobias. So, the correct answer here is depression. So, behavioral activation is specifically designed to treat depression by helping individuals increase their engagement in meaningful, value based activities. It is based on the principle that depression involves reduced activity and withdrawal from the rewarding experiences. Hence, this is the correct answer. In schizophrenia, antipsychotic medications and specialized psychosocial interventions are involved. PTSD, here more effectively treated with trauma focused CBT, phobias with exposure therapy. Hence, depression is the correct answer. Now, the core principle of exposure therapy is repeated confrontation with feared stimuli, challenging irrational thoughts, exploring early childhood trauma, and encouraging positive reaffirmations. So, the correct answer here is repeated confrontation with feared stimuli. A. So, exposure therapy, it is based on the principle that repeated controlled confrontation with feared stimuli, it leads to habituation and extinction of anxiety responses. This allows the individual to learn that feared situations are not actually dangerous. All right. Challenging irrational thoughts, core principle of cognitive therapy. Exploring early childhood trauma, which is characteristic of psychodynamic therapy. Encouraging positive affirmations, not a core principle of exposure therapy. Hence, exposure therapy works through systematic, repeated confrontation with feared stimuli to achieve habituation and anxiety reduction. Narrative therapy helps the clients by reconstructing personal stories in a meaningful way, analyzing unconscious motives, engaging in mindfulness exercises, and using systematic desensitization. So, here the correct answer is reconstructing personal stories in a meaningful way. So, narrative therapy was developed by Michael White and David Epstein, which help the clients reauthor their life stories by identifying unique outcomes and alternative narratives that challenge the problem saturated stories. All right. It separates the person from the problem and it empowered the client to become the author of their own preferred stories. Why analyzing the unconscious motives is the wrong answer? Because it is a psychoanalytic approach. Engaging in mindful exercises is mindfulness based approach. Using systematic desensitization is behavioral technique for anxiety. So narrative therapy, it empowers the clients to reconstruct their life stories in ways that highlight their strengths and preferred identities. Now, which of the following is used to compare means of two or more groups? ANOVA, t-test, multiple regression, or chi-square? Here, the correct answer is A, which is ANOVA, analysis of variance. It is used to compare means across two or more groups simultaneously. It determines whether there are statistically significant differences between group means while controlling for type 1 error across the multiple comparisons. Alright, t-test, it is used for comparing means between only two groups. Multiple regression, it is used for predicting outcomes based on multiple predictors. Chi-square is used for testing associations between categorical variables. So, ANOVA is the appropriate statistical test when comparing means across multiple groups, extending beyond the two group limitation of t-tests. Alright, so hence A is the correct answer. Which of the following is a hallmark of qualitative research? randomized controlled, statistical generalization, subjective experience, or large sample size. So here subjective experience is the correct answer. So qualitative research is fundamentally concerned with understanding the subjective experiences, the meanings and the interpretations that individuals give to their life and their experiences. So it seeks to understand the phenomena from the participants' perspectives rather than imposing any predetermined categories. Okay. Why is randomized control not the right answer? Because that is a characteristics of quantitative experimental research. So this is quantitative experimental research. Statistical generalization is characteristics of quantitative research. This is again quantitative research. A large sample size is typically associated with a quantitative research again. So, the qualitative research prioritizes understanding the subjective experiences and meanings rather than the objective measurement and statistical analysis. Okay, hence C is the correct answer. Now, grounded theory is used to prove a hypothesis, develop a theory from data, measure statistical correlation, or test causality. The correct answer is B. So, grounded theory is a qualitative research methodology that aims to develop theory that is grounded in systematic collection and the analysis of data. So, rather than testing the existing theories, it generates new theoretical frameworks from the data itself through integrative analysis. Okay, so here rather than we are testing the existing theories, we are generating new theoretical frameworks. So proving a hypothesis, this is the goal of quantitative hypothesis testing. Measuring the statistical correlation, this is again quantitative analysis. Testing causality, this requires the experimental or the quasi-experimental designs. So, grounded theory is an inductive approach that builds theoretical understanding directly from systematic data analysis. Which method is not used in quantitative research? T-test, thematic analysis, chi-square, or regression? So here we are talking about thematic analysis, B as the correct answer. Why? Because thematic analysis is a qualitative research method which is used to identify, analyze, and report patterns. Here we are identifying, analyzing, and we are reporting patterns which are the themes within the qualitative data. So it involves coding and categorizing the textual data rather than statistical analysis of the numerical data. What does a t-test do? It is used in quantitative research, comparing the means, right? Chi-square, statistical test used in quantitative research, and regression is the statistical analysis method used in quantitative research. So, thematic analysis is a qualitative method which analyzes the textual data, while the other options are statistical techniques which are used in quantitative research. Moving on. Triangulation in qualitative research refers to using three variables, repeating measures, using multiple methods to ensure credibility, and combining three data sets. So here it is known as using multiple methods to ensure credibility. So triangulation, it involves using multiple methods or sources, so researchers or theoretical perspectives also to study the same phenomenon. Okay, multiple people, multiple resources, multiple methods are used to study the same phenomenon. So this actually enhances the credibility and the trustworthiness of the qualitative research by providing multiple lines of evidence and reducing the impact of potential biases. Okay, so using three variables, this is not the definition of triangulation. Repeating measures, this is more like reliability testing, not triangulation. Combining three data sets, which is too narrow. Triangulation can involve various forms of multiplicity. Okay, so triangulation, it strengthens the qualitative research credibility by incorporating multiple approaches to study the same phenomenon. Hence, C is the correct answer. Member checking is used to test reliability, confirm validity with participants, compare two groups and analyze variance. So here it is used to confirm validity with participants. So member checking, it involves returning research findings or the interpretations or the conclusions to participants to verify the accuracy and validity. So this qualitative research technique, it enhances the credibility by ensuring that researchers' interpretations, they align with the participants' intended meanings. Test reliability is member checking focuses on validity, credibility, not reliability. Comparing two groups, this is not the purpose of member checking. Analyzing the variance, this is a quantitative statistical procedure. So, member checking enhances the validity and credibility of qualitative research by confirming findings with the original participants. Hence, B is the correct answer. Which of the following is a type of ordinal data? Blood pressure, IQ score, interview transcript, reaction time. So, while IQ scores are often treated as interval data, they technically represent ordinal data because the intervals between scores may not be truly equal, and they represent ordered categories of intellectual functioning rather than precise measurements on a continuous scale. Okay, so the blood pressure reading is a continuous interval data. This is continuous interval data with equal intervals. Interview transcript is qualitative categorical data. This is qualitative categorical data. Reaction time, this is continuous interval data measured in equal time units. So, reaction time is the continuous interval data measured in equal time units. Hence, IQ score is where ordinal data involves ordered categories and the rank order matters, but the intervals between categories may not be equal. Hence, B is the correct answer. Phenomenology focuses on cultural interpretation, lived experiences, experimental conditions, or survey responses. Lived experiences. So, phenomenology is a qualitative research approach that focuses on understanding the lived experiences of individuals and the meanings that they attribute to those experiences. So, it seeks to understand phenomena as they are experienced by participants in their natural settings. Okay. The cultural interpretation is more of a characteristic of an ethnographic research. The experimental conditions is quantitative experimental research. Survey responses, more characteristics of survey research methodology. Hence, phenomenology seeks to understand the sense of lived experiences and the meanings individuals assign to these experiences. What is a key limitation of qualitative research? lacks depth, cannot explain human experience, limited generalizability, and lacks ethical concerns. So it is limited generalizability. Why? Because due to small sample sizes and context specific findings, the qualitative research typically has limited generalizability to broader populations, right? So here small sample size is there, and also it has context specific findings. Context specific findings. All right. So these findings are often specific to the particular participants or their settings and contexts which are studied, which makes the statistical generalization inappropriate. Now, it says that it lacks depth. So actually, qualitative research is known for providing very rich and in-depth understanding. It cannot explain human experience. This is actually a strength of the qualitative research. It lacks ethical concerns. So, qualitative research has the same ethical requirements as a quantitative research. Now, purposive sampling is random, it is representative of population, is based on characteristics of interest and unbiased. So, this is based on characteristics of interest. Purposive sampling is a non-probability sampling technique where participants are deliberately selected based on the specific characteristics or the qualities or the criteria that are relevant to the research question. If I want to assess a phenomenon in doctors, I will pick up doctors, right? If I want to assess something in teachers, I will assess teachers only. So researchers intentionally choose participants who can provide the most informative data. Random, so random sampling gives every member of the population an equal chance of selection, hence it is the incorrect answer. Representative of population, so this is the goal of probability sampling methods. Unbiased, all sampling methods have some form of bias. The purposive sampling has selection bias by design. So, purposive sampling deliberately selects the participants with specific characteristics that are most relevant to the research questions. Coding in qualitative research involves assigning numbers to data, summarizing statistical findings, labeling themes or patterns, and programming a model. So, here it is labeling themes or patterns. So, coding in a qualitative research, it involves systematically labeling and categorizing the segments of the data to identify the themes, patterns, and concepts. Okay, so this process, it helps researchers organize and make sense of textual data by assigning meaningful labels to different segments. Now, when it says assigning numbers to data, this is quantitative coding, not qualitative coding, right? Summarizing statistical findings, that is characteristics of quantitative. Programming a model, here this refers to computer programming, not qualitative data coding. So qualitative coding involves systematic labeling of data segments to identify meaningful themes and patterns rather than numerical findings. Alright, so C is the correct answer. Now, who proposed the concept of schemas in cognitive development? Piaget. So, Piaget proposed the concept of schemas as cognitive structures that help the individual to organize and interpret information. So, schemas are mental frameworks that develop through experience and guide how we understand and interact with the world. Okay, so these are mental frameworks. Skinner is known for operant conditioning and behaviorism. Freud is known for psychoanalytic theory and psychosexual development. Maslow is known for hierarchy of needs and humanistic psychology. Hence, Piaget is the correct option. Now, which of the following best explains the participatory research from more traditional research paradigms? A. It prioritizes double-blind procedures to eliminate bias from participant expectations. B. It maintains strict researcher objectivity and avoids any collaboration with participants. C. It involves stakeholders as co researchers throughout the research process, including question formulation and data interpretation. And D. It uses random sampling to ensure the generalizability of findings to broader population. The correct answer here is C. So, it involves stakeholders as co researchers throughout the research process, including question formulation and data interpretation. Why? Because participatory research involves community members and stakeholders as active co researchers rather than passive subjects. So, participants are involved in all phases, including the identifying research questions, collecting data, analyzing researches, and implementing the findings. So, A is the incorrect answer. Why? Because this is characteristics of experimental research design. This is experimental research design. B is traditional research emphasizes objectivity. Participatory research embraces collaboration. Participatory research embraces collaboration. D. Here, the sampling method is not what distinguishes participatory method. Okay. Hence, participatory research, it transforms the traditional power dynamics by involving the stakeholders as equal partners throughout the entire research process. Now, cognitive dissonance theory was developed by Festinger. So, Leon Festinger developed cognitive dissonance theory, which explains the psychological discomfort experienced when holding contradictory beliefs, values, or attitudes simultaneously. So, this discomfort motivates people to reduce the dissonance through various strategies. Bandura, he was known for social learning theory and observational learning. Ellis was known for rational emotive behavior therapy. Piaget is known for cognitive developmental theory. So Festinger's cognitive dissonance theory, it explains how people resolve the psychological discomfort arising from conflicts, beliefs, or attitudes. Okay, so which concept refers to mental shortcuts in thinking? Insight, heuristics, intelligence, or schema? So the correct answer is heuristics. So heuristics are the cognitive shortcuts or rules of thumb. This allows the people to make quick decisions and solve problems efficiently. So while useful for rapid decision making, heuristics can sometimes lead to systematic errors in our judgment. What is insight? Insight is an understanding or the solution to a problem. Intelligence is the general cognitive ability. Schema is the cognitive framework which is used for organizing the knowledge. So, heuristics are the mental shortcuts that enable efficient decision making but can sometimes lead to cognitive biases and errors. Hence, B is the correct answer. Lashley's mass action principle primarily challenged which of the following beliefs? A. That specific brain areas control motor movements. B. That brain lesions have no impact on learning. C. That memories are stored diffusely across the cortex. And D. The learning is localized in discrete brain regions. So, the correct answer is D. So, the correct answer is D. So Carl Lashley's mass action principle, it suggested that learning and memory involve the brain as a whole rather than being localized in specific discrete regions. This challenged the prevailing view of strict localization of brain functions. Now, why is A incorrect? because this wasn't Lashley's primary focus. B is incorrect because Lashley studied the effects of lesions on learning. C is incorrect because this actually supports Lashley's view. So, Lashley's mass action principle proposed that learning involves distributed brain networks rather than discrete localized regions. Moving on, cognitive triad in depression includes self, world, and future, id, ego, superego, past, present, or future, thoughts, emotions, and behaviors. Correct answer here is self, world, and future. So, Beck's cognitive triad describes the three areas of negative thinking in depression: negative view of the self, I'm worthless; negative view of the world is hostile; and negative view of the future, things will never improve. Id, ego, and superego, these are Freud's structural components of personality. Past, present, and future, the triad focuses on the self, world, and future specifically. Thoughts, emotions, and behaviors, these are components of the cognitive behavioral model but not the triad. So, Beck's cognitive triad identifies three areas of negative thinking that characterize depression, which is self, world, and future perspectives. Okay, moving on. What is a core concept of Bandura's cognitive theory? Classical conditioning, observational learning, psychoanalysis, or moral reasoning? The correct answer is B, which is observational learning. So Albert Bandura's social cognitive theory, it emphasizes observational learning or even modeling, where individuals learn by observing others' behaviors and their consequences. So, this challenged the purely behaviorist explanations by demonstrating learning without direct reinforcement. So, classical conditioning is, in Pavlov's concept, not primarily associated with Bandura. Psychoanalysis, Freud's approach, not related to Bandura. Moral reasoning, more associated with Kohlberg's work. Okay, so here Bandura's observational learning demonstrates that people can learn complex behaviors by watching others without direct personal experience or reinforcement. Hence, B is the correct answer. Now, according to Piaget, which stage involves abstract thinking? Sensory motor, pre-operational, concrete operational, or formal operational? So the correct answer here is formal operational. So Piaget's formal operational stage, which is typically beginning around the age of 11 or 12, it is characterized by the ability to think abstractly, use hypothetical reasoning, and consider multiple variables simultaneously. So, this represents the highest level of cognitive development in Piaget's theory. Now, why is sensory motor the incorrect option? Because it involves learning through senses and motor actions. Why sensory motor is the incorrect option? Because it involves learning through senses and motor actions, which is between the age 0 to 2. Pre-operational, it involves symbolic thinking but not abstract reasoning, age 2 to 7. Concrete operational involves logical thinking about concrete objects, 7 to 11. So the formal operational stage, it represents the pinnacle of the cognitive development, enabling abstract reasoning and hypothetical thinking. Now, which is an example of cognitive distortion? Observational learning, mind reading, reinforcement, or free association? The correct answer is mind reading. Mind reading is a cognitive distortion where individuals assume that they know what others are thinking without any evidence. So it involves making negative assumptions about others' thoughts, motivations, even without any sort of verification. So here, observational learning is a normal learning process which is identified by Bandura. Reinforcement is a learning principle from operant conditioning. Free association is a psychoanalytic technique. So, mind reading represents a systematic error in thinking where assumptions about others' thoughts are made without any evidence. Assumptions without evidence. Cognitive appraisal refers to judging others, evaluating environmental stressors, unconscious motives, or genetic traits. So, cognitive appraisal refers to evaluating environmental stressors. So, cognitive appraisal, it is the process by which an individual evaluates and interprets the potentially stressful events. All right. So, according to Lazarus, this evaluation determines whether an event is perceived as threatening, challenging, or irrelevant. Right? So, judging others here, it's not the psychological definition of cognitive reappraisal, it's an incorrect option. Unconscious motives, it is related to psychodynamic concepts, not cognitive appraisals. Genetic traits are the biological factors, not cognitive processes. So, cognitive appraisal determines how we interpret and respond to potentially stressful situations, which influence our emotional and behavioral reactions. Moving on. Which school of psychology emphasized introspection? Behaviorism, structuralism, humanism, or psychoanalysis? The correct answer is B, which is structuralism. So, this was led by William Wundt and Edward Titchener, and it emphasized on introspection as a method to study the structure of the consciousness by having trained observers report on their immediate conscious experiences. All right. So, here what are we doing? We are trying to study the structure of our consciousness by having some trained observers report on their immediate conscious experiences. What does behaviorism say? It rejected introspection in favor of observable behavior. Hence, this is not the right answer. Humanism, it focuses on subjective experience but not specifically on introspection. Psychoanalysis, it used the free association and dream analysis rather than systematic introspection. So, structuralism was the first major school of psychology to systematically use introspection to study the basic elements of consciousness. Who is considered the father of experimental psychology? Freud, Wundt, Watson, or Skinner? William Wundt. So he is considered the father of experimental psychology because he established the first formal psychology laboratory in 1879 in Leipzig, Germany, and he pioneered the use of controlled experimental methods in psychological research. Right. So we all know that he established the first lab in 1879 in Leipzig in Germany. Freud is known for psychoanalysis, not experimental methods. Then Watson is an important behaviorist but came after Wundt's establishment of the lab. Skinner is again an important behaviorist but came after Wundt. So Wundt's establishment of the first psychological laboratory marked the beginning of psychology as an experimental science which was separate from philosophy. Now, operant conditioning was proposed by Bandura, Skinner, Pavlov, or Thorndike. So here the answer is B, which is Skinner. So B.F. Skinner, he developed the principles of operant conditioning, which focuses on how behavior is modified by its consequence through reinforcement and through punishment. So this expanded on Thorndike's earlier work on the law of effect. Okay. So Bandura, he is known for social learning theory and observational learning. Pavlov is known for classical conditioning. Thorndike, he proposed the law of effect which influenced Skinner's work. So Skinner's operant conditioning explains how behavior is shaped by its consequences through reinforcement and punishment. Hence, B is the correct answer. Which type of memory lasts for only a few seconds? Long term, semantic, sensory, or working? So it is sensory memory. Sensory memory, it is the briefest form of memory. It lasts only a milliseconds to few seconds. It holds the sensory information just long enough for it to be processed and either transferred to short-term memory or discarded. Long-term memory could last indefinitely. Semantic memory is a type of long-term memory for general knowledge. Working memory lasts about 15 to 30 seconds without rehearsal. So, sensory memory provides the briefest retention of sensory information, which acts as a buffer before information enters to the short term or the long term memory. Hence, C is the correct answer. Now, which theory emphasizes self actualization? It's easy, humanistic. So, humanistic theory, particularly as developed by Abraham Maslow and Carl Rogers, it emphasizes self actualization as the highest level of the psychological development. It represents the realization of one's full potential and authentic self. Psychoanalytic theory, it focuses on the unconscious conflicts and early experiences, hence it's not the right answer. Behaviorist, it focuses on learned behaviors and environmental influences, again incorrect. Cognitive, it focuses on thinking processes and information process, hence humanistic theory is uniquely emphasized on human potential for growth and self actualization as the primary motivation in psychological development. Hence, C is the correct answer. Now, classical conditioning involves reinforcement, voluntary behavior, involuntary response to stimuli, and modeling. So, here it involves involuntary response to stimuli. So, classical conditioning involves learning associations between stimuli that lead to involuntary or reflexive responses. Okay. The conditioned response occurs automatically when the conditioned stimulus is presented without any conscious control. Now, why is reinforcement an incorrect answer? Because this is a characteristic of operant conditioning, not classical. Voluntary behavior, operant conditioning deals with voluntary behaviors. Modeling, it is observational learning. So, classical conditioning creates automatic involuntary responses to previously neutral stimuli through repeated associations. Now, the Yerkes-Dodson law explains the relationship between arousal and emotion, learning, performance, or memory. The correct answer is performance. So, the Yerkes-Dodson law describes an inverted U-shaped relationship between arousal and performance. Optimal performance occurs at the moderate levels of arousal when with both low and high arousal levels leading to decreased performance. Okay, so optimal performance occurs at moderate levels of arousal, but low and high arousal levels leads to decreased performance. So why is emotion the incorrect option? While it is related, the law specifically addresses performance only. While arousal affects learning, the law specifically focuses on performance. And while arousal affects memory, the law again specifically describes the arousal performance relationship only. Alright, so the Yerkes-Dodson law demonstrates that moderate arousal levels optimize performance, while both very low and very high arousal impairs the performance, right? So here we need optimal level. Hence, C is the correct answer. Now, question 100. Latent learning challenges which of the following assumptions of strict behaviorism? Learning only occurs through shaping. Reinforcement is required for learning to occur. Extinction reduces the likelihood of behavior permanently. Classical conditioning precedes operant conditioning. So here the correct answer is B. So latent learning, it was demonstrated by Tolman's experiments with rats in the mazes. It showed that learning can occur without immediate reinforcements. So the rats learned the maze layout even when not reinforced, which demonstrated learning in the absence of rewards. So A is the incorrect option because shaping is one method, but behaviorism doesn't claim it's the only method. C is incorrect because this addresses extinction, not the core challenge of latent learning. D is incorrect because this addresses temporal relationships, not the reinforcement requirements. So, latent learning, it demonstrates that learning can occur without reinforcement, challenging the behaviorist assumption that reinforcement is necessary for all the learning. All right, hence B is the correct option. Thank you. Now, we will be shortly joined by Dr. Praveen Tripathi, who's a faculty at Conceptual Psychology and who's here to help you with the questions related to abnormal psychology. Thank you.
Let us discuss the questions from abnormal psychology and physiology. The first one is, which neurotransmitter is most commonly associated with schizophrenia? Now, two neurotransmitters that are most commonly associated are dopamine and serotonin. We know that your delusions and hallucinations, the two psychotic symptoms, are caused by a hyperdopaminergic state. Hyperdopaminergic state. That is why the antipsychotics you use, which usually work by blocking the dopamine receptors, or also called as dopamine antagonist, they are effective in treating delusions and hallucinations, because if delusions and hallucinations are caused by excessive dopaminergic activity, the medication that blocks those receptors will bring down the symptoms. Similarly, even excessive levels of serotonin have been implicated, because the drugs which are acting as serotonin receptors blockers or serotonin receptor antagonists, even they are effective in decreasing the symptoms of schizophrenia. In fact, even acetylcholine, glutamate, norepinephrine, GABA, all these neurotransmitters have been implicated in the pathophysiology of schizophrenia, even nicotine. But if you have to pick one, the best answer becomes dopamine. If you have to pick one, the best answer becomes dopamine. If there was an option, all of the above, and if the question said which neurotransmitters are commonly associated with schizophrenia, and if one of the options was all of the above, then all of the above would have been the best answer, because all of them have been implicated. But if you have to pick one, you will pick dopamine, right? So the answer to the question number 7 is dopamine. Alright, this is a slightly problematic question. A patient presents with fluctuating levels of consciousness, visual hallucinations, and autonomic dysfunction. Which condition is most likely? Schizophrenia, dementia with Lewy bodies, major depressive disorder, and OCD. It is a question that can be very easily guessed, right? Of course, in schizophrenia, we don't see any disturbance of consciousness. In depression or OCD, we would not see any disturbance of consciousness. So you can rule them out and the answer becomes B. But if you dive a bit deeper, dementia with Lewy body is characterized by a triad. There are 3 symptoms. What are these 3 symptoms? Fluctuating levels, or if you can call it consciousness, or fluctuating levels of, say, attention. The cognitive functioning tends to fluctuate. The attention fluctuates, consciousness fluctuates. So one of the symptoms is fluctuating levels of attention or consciousness. The second one is visual hallucinations. Visual hallucinations. And the third symptom of triad is not autonomic dysfunction, it is Parkinsonian features. Parkinsonian features. Symptoms suggestive or symptoms similar to Parkinsonism. What are the symptoms similar to Parkinsonism? We have tremors, we have rigidity. These are the symptoms which form the third symptom of the triad. Now, this question is giving autonomic dysfunction, which is not a part of the triad. But looking at the options available, dementia with Lewy body becomes the best answer. But please remember the triad: fluctuating levels of attention or consciousness, visual hallucinations, and Parkinsonian features. Another question that can be asked from dementia with Lewy body is Capgras syndrome. Capgras syndrome, which is a delusion of misidentification It is commonly seen in patients who have dementia with Lewy body. So remember, this is an extra information. The primary feature distinguishing bipolar 1 disorder from bipolar 2 disorder is. So what is bipolar 1 disorder? If a patient develops even a single episode of mania, a single episode of mania is enough to make a diagnosis of bipolar 1. These patients usually have episodes of both mania and depression, but even a single episode of mania is enough to make a diagnosis of bipolar 1. Why? If I am saying that bipolar 1 has both mania and depression, why am I also saying that even a single episode of mania is enough to make a diagnosis of bipolar 1? Reason is, if a patient had an episode of mania, we are sure that sooner or later he will have an episode of depression also. That is why, even with a single episode of mania, we can make a diagnosis of bipolar 1. What is bipolar 2? To make a diagnosis of bipolar 2, you have to have at least one episode of depression and one episode of hypomania. Now, this is not mania, it is one episode of hypomania. So, at least one episode of depression and one episode of hypomania. So, what is the differentiating feature here? Mania. Depression can happen in both bipolar 1 and bipolar 2. Even hypomania can happen in both bipolar 1 and bipolar 2. Say a patient develops an episode of mania. You diagnose him with bipolar 1. 1 year later, he developed an episode of depression. What is the diagnosis? Bipolar 1 current episode depression. Now, say he developed an episode of hypomania. What is the diagnosis? Bipolar 1 current episode hypomania. Once he had even a single episode of mania, you make the diagnosis of bipolar 1. But in patients in bipolar 2, we cannot have episodes of mania. If a patient who has been diagnosed in bipolar 2 develops an episode of mania later on, the moment he develops a manic episode, the diagnosis will shift from bipolar 2 to bipolar 1. So, presence of manic episode is what we differentiate bipolar 1 from bipolar 2. Alright. Now, this is a question on aphasias. We know that aphasias are characterized by language disturbances. So, all these terms are important. Wernicke's, Broca's, conduction aphasia. So, I did a diagram here. Now, this is your Wernicke's area. And this is your Broca's area. What is the purpose of Wernicke's area? Comprehension of spoken speech. Comprehension of speech. And what is the function of Broca's area? Production of speech. Generation of speech. And these two are connected by what is called as arcuate fasciculus. So if I'm speaking, you are listening to me, and then your brain is comprehending what am I speaking. This comprehension is happening at Wernicke's area. Now, once, say you were sitting in front of me, and I was teaching you something and I asked you a question. When I spoke a question, you would hear it, and then your Wernicke's area would comprehend it. It would understand what I have asked. And then information will go through arcuate fasciculus, and then you would respond using your Broca's area. Now, this Broca's area is a part, it is present in inferior frontal gyrus, a part of frontal lobe. Whereas this Wernicke's area is present in superior temporal gyrus. This is the part of frontal lobe, this part of temporal lobe. Superior temporal gyrus. Now, say there is an injury in your superior temporal gyrus. Your brain developed an emboli and there is loss of supply to this part, and you developed an injury to this part. This would lead to Wernicke's aphasia. Wernicke's aphasia. What will happen in Wernicke's aphasia? Now you cannot comprehend anything. You are not able to understand anything. So you are not able to understand anything, but you can speak. So what is the presentation? The patient keeps on speaking. The patient keeps on speaking, but cannot understand, but cannot comprehend the spoken speech. You ask him a question, and what he replies is completely different. You ask him a question, he cannot understand it. He replies something which is completely different. That is why these patients, the clinical presentation is they are speaking, but what they are saying is full of jargons. Sometimes you also call it jargon aphasia. Jargon aphasia. What they are saying is does not make sense. On the other hand, if your Broca's area gets damaged because of any injury, usually vascular injury, what will happen? Now you cannot speak properly. Although you can understand, but you cannot speak properly. So these patients speak, very in very brief, in a very brief manner. Also called as telegraphic speech. It appears very effortful. So telegraphic speech is where they are only speaking nouns or verbs. For example, say you ask one patient who has Broca's aphasia to describe a person who is studying on laptop. You ask him what is he doing, so he would not be able to say he is studying with the help of laptop. He is watching a lecture. He would say something like this. Say the name of that person is Rohit. Rohit sitting laptop studying. He will speak like this in a telegraphic manner. He would not be able to make a proper sentence that Rohit is having a laptop in front of him and on the screen a lecture is playing and he is studying the subject of psychology. This he would not be able to say. It would be a telegraphic speech. So because Broca's area is involved in production of speech, the production of speech is very restricted. Whereas in Wernicke's area, the comprehension is restricted. He's not able to understand. He keeps on saying, speaking, but what he says speaking is senseless because he's not able to understand what is being asked to him. And if this arcuate fasciculus, which connects the two, gets damaged, it can lead to what is called as conduction aphasia. Conduction aphasia, the characteristic feature of conduction aphasia is repetition is impaired. Repetition is impaired. For example, if I ask a patient who has conduction aphasia, repeat the sentence, no ifs, ands, buts. He would not be able to say it. He said no, no, but, so why? Because comprehension is happening. But then this information which had to be passed to Broca's area, it is not going through. So the repetition is getting impacted. All right. Now let's go back to the question. So a lesion in inferior frontal gyrus would of course lead to Broca's aphasia. And a lesion of superior temporal gyrus would lead to Wernicke's aphasia. A lesion in arcuate fasciculus would lead to conduction aphasia. Anomic aphasia is characterized by difficulty in naming. It is difficulty in finding words. These patients have difficulty in finding words. For example, a patient would say, I have this thing in my hand. It is white in color. It is cylindrical, but he would not be able to say penicillin. So word finding difficulty is saying anomic aphasias. Alright, guys. Next one is a simple question. The primary function of the limbic system is, all of you know, it is all about emotional regulation. The motor coordination is primarily done by your cerebellum, even motor cortex. Visual processing usually happens in the occipital lobe. And language production we just read about. Which of the following best describes delusion? So delusion is a false belief, firm belief, which is not in keeping with the background of the person, socio-cultural background. And it is not amenable to reasoning, right? So is it a perceptual disturbance? No. What are perceptual disturbances? Commonly we talk about illusions and hallucinations. A fixed false belief not amenable to reason. This is the definition of delusion. A false belief which is not amenable to reasoning and not in keeping with the background of the person. Of course, not a mood disorder. Of course, not an obsession. Answer is B. What is a primary delusion? And what is a secondary delusion? Now, these terms are self-explanatory. Primary, which is, something which originates by itself. Secondary, which is in response to something. So, secondary delusions, for example, say a patient has hallucinations. He hears voices, the voices keep on saying, you will be killed, you will be killed, you will be killed. And now he develops a delusion that somebody wants to kill me. Somebody wants to kill me. He develops a delusion of persecution that somebody wants to kill me. So this delusion of persecution has developed secondarily to the auditory hallucination, which was saying you will be killed. This is secondary delusion. So secondary delusion is a delusion which can be explained on the basis of some other psychopathology, like hallucination. So what is primary delusion then? Primary delusion is something which results directly because of the disease process. A patient develops schizophrenia because of the schizophrenia disease. Something is developing directly. That is primary delusion, which develops directly because of the disease process. Right? So we have examples of primary delusions. So like certain delusional idea is a type of primary delusion. Then you can have say, delusional perception, which is another type of primary delusion. You can have delusional memory. You can have delusional mood. All these are types of primary delusion. So anything which can be explained on the basis of some other symptom becomes a secondary delusion. So if it is developing secondary to hallucination, it's a secondary delusion. If it is based on mood, for example, a patient has severe depression and this patient now develops nihilistic illusion. A patient who has severe depression develops a nihilistic illusion that all my internal organs are rotten. Now this nihilistic illusion can be explained on the basis of his depressed mood. So it is also a secondary delusion. So arising suddenly without any cause or without any explainable cause would be the definition of primary delusion. Which term describes a false sensory perception without any external stimulus? So it is hallucination. The definition of hallucination is false perception without any object or stimulus. There is nothing, no stimulus, but the patient has developed the perception. On the other hand, what is illusion? False perception of a real object or a real stimulus. For example, if I look at this pencil and if I say, I see a white umbrella, this is an illusion. Why? I'm wrongly perceiving a pencil as umbrella. But if say there's nothing in my hand and I say, I see a black umbrella, now that's a hallucination because there is no stimulus, but I'm still seeing something. An individual believing that TV is sending messages is experiencing. Now, when you start seeing patients, especially with patients, since the patients who have schizophrenia, you would commonly find the symptom. Patient would come to you and he would say, Doctor, when I watch TV, when the characters are talking, I feel as if they are talking to me or as if they are giving me some information. This is a delusion of reference. In delusion of reference, what happens is the patient starts believing that neutral events, the neutral events are somehow in relation to me. Neutral events are in relation to me. If two people are talking, they are talking about me. If somebody is smiling, she is laughing at me. If a character is speaking on TV, he is talking to me. So, neutral events are in relation to me. This is referential delusion. The nihilistic illusion I talked about, it has to do something with end. Nil. Nihilism, nil. Right? Say a patient comes and says, all my internal organs are rotten. Or a patient comes and says, everybody in the world is dead. This is all nihilistic illusion. Persecuted illusion is somebody wants to harm me. A patient comes and says, my family members want to kill me. My neighbors is making a conspiracy to take my property. The police is following me. All of this will come under persecuted illusion. And somatic illusion, as the name suggests, it is something to do with the body. Something to do with the body. Say a patient comes and says, ki, my liver has been shifted to another part of my body. This becomes a somatic delusion. Changes in consciousness are likely seen in the answer is delirium. Delirium is primarily characterized by disturbance of consciousness. When you start seeing patients, especially say you go to ICU and you are seeing a patient who is confused. Patient is confused. Whenever you see this word patient is confused, it means the patient's consciousness is disturbed. Patient is not alert. Patient is not fully alert. Patient is not fully awake. So disturbance of consciousness is the primary symptom of delirium. Dementia, there is never any disturbance of consciousness, but it may fluctuate. Like we talked about dementia with Lewy body, there the consciousness may fluctuate a lot. So that is one dementia where there is a disturbance or fluctuation of consciousness. Otherwise, in dementia, the consciousness is usually not involved or not disturbed. In delirium, there can be multiple symptoms, but there are three symptoms that you must remember. First of all, it is disturbance. There is disturbance of consciousness. Secondly, there can be disorientation. Disorientation to time, place, and person. You ask the patient what time is it? Patient does not know. In the evening, patient will say it's morning hours. You ask the patient, where are you? The patient is in the hospital, but he might say that I'm in the jail. And finally, the patient may not be able to identify the family members. And the third one is perceptual disturbances. Perceptual disturbances, like most commonly, visual hallucinations. For example, the patient says, in the ward, he says that I can see small insects all around me. This is visual hallucination. This answer is delirium. Which symptom is considered a disorder of possession of thought? Now, in disorders of possession of thought, we can have thought insertion, where the patient believes that somebody is putting thoughts in my mind. Thought insertion. Thought withdrawal. Patient says, somebody is withdrawing or stealing thoughts out of my mind. I cannot think of anything because somebody is using some technology to take away all my thoughts. Thought broadcast. Patient says, whatever I think, it gets broadcasted and everybody understands it. Like there is broadcasting on TV, and if it is happening somewhere and it is getting broadcasted, everybody gets excited. Similarly, the patient says, whatever I think, it gets broadcasted, everybody understands it. And even observation is sort of considered as disorders of possession of thought. So the answer is for disorder of him. So the complexity is a stream of thought. Like idea is also a visible of stream of thought. And the initiality is usually considered as a third of bottom of thought. Most symptoms are the electricity of umbilical region, the electricity of genital area. In fact, the coordinates is FFRS, Nigerian, first rank symptoms. Kurt Schneider gave these symptoms, and he believed that if a patient has any of these, the likelihood of schizophrenia is very high. If it can involve the other organic disorders or sort of transductive disorders. So it's a list of 11 symptoms. 11 symptoms. SLFRS. Schneiderian first rank symptoms. Can you recall what are these 11 symptoms? We can remember them by dividing them into smaller those. What are the symptoms? 3 thought phenomena. Thought insertion. Somebody is putting the thoughts in my mind. Thought withdrawal. Somebody is stealing your mind thoughts. Thought broadcast. Whatever I think, everybody understands it. So the 3 thought disorders, thought phenomena. Then in 3 main phenomena. made volition. What is the meaning of volition? Usually, use it as of action. Volition and role is voluntarily on a role, but the term made volition is used as of action. So patient says that some action is reinforced the one week. I have been forced to some action. I had a patient, what he would do, he would suddenly stand on his bed and he would try to put his hand in the fan, moving fan. And when he asked what are you doing, he would say, Doctor, I'm not doing anything. My answer, पूरा automatically towards it है. मैंने access करा भी control by somebody. So this is mere volition. There is mere affect. The term affect is used for egoists. So patient says, somebody is forcing motion upon me. Patient suddenly starts laughing in the void. You ask him why is happy? He will say, I'm not happy. So somebody is using a remote control to change my emotions, made an effect. And then the third made phenomena is made impulse. Patient says, I'm getting these impulses, somebody is putting these impulses in me. Patient says, Doctor, I have a very strong urge to slap you. And it's not my urge, somebody is putting this urge in me. Stay away from me, otherwise you get slapped. 7 times out of 3 times on a body resistance. So what are these voices? Arguing or discussing about the patient. Patient says, I hear two voices. They talk to each other and they talk about me. They argue about me. They discuss me. Then there is voices giving running commentary. Patient says, whatever I do, I hear a voice in the commentary. If I'm going from my bedroom to my teacher to have the last of the water, I will hear a voice to say, he just walked off from the bed. He moved the slippers. He is moving towards the face. He did go to the water and he ran the water. So, a couple is going on by action. And then a voice is saying thoughts aloud. Also the word is thought echo. Patient says, whatever I think, a voice says that they think. For example, if I am thinking that after the last, I will have a good meal. I will say, after the last, I will have a good meal. Whatever I think, I hear the same. Why? Because it's already resolution stays the same thing. So how many I covered? 9. So we will remember that there is 3,000 phenomena, 3 many phenomena, and 3 are resolution. And what is called as illusion or perception. What is the meaning of perception? To a normal perception, or delusion is attached. A normal perception, or delusion is attached to a delusion, meaning is you are about perception. For example, if I say, the color of this capital when it is white, it means I'm the lecture fan of the word. It is a word. The color of this when it is white, which means I have the lecture fan of the word. On an order perception, we would have the delusion of curiosity in an ununderstandable manner. And lastly, we have both somatic specificity. In somatic specificity, what happens? Patient and other somatic sensations and blaze an external regeneration about the thing. For example, we can say, I'm having these tingling sensations in my right elbow, sensation in my right elbow, and I was studying this sitting in Karachi, Pakistan. Fully radio is from there, which is causing these tingling sensations in my elbow. This is somatic specificity. Video of the following is a negative symptom. So, hallucination was a symptom of psychological symptoms. Why are there positive symptoms? Because the schizophrenia disease is creating some new version. Normally, if you hallucinate, you don't have illusion. Because schizophrenia has delivered another new version. That is why positive. And why are negative symptoms for negative symptoms? Because the normal brain function is locked. So, what are the negative symptoms? We have got evolution. What is the meaning of evolution? Lack of drive. The patient does not have the drive to do any meaningful activity. So, so many levels schizophrenia. Develops an evolution. It does not have the drive to do it. It does not feel like study. It does not take bath. It does not meditate hygiene. Loss of drive for meaningful activity. The other negative effect is irritability, lack of concern. Say, just community develop, six of the linear. Because of pollution, he stopped going to college and stopped studying. Now he is failed in the exam, but it does not care because he also has irritability, lack of concern. Then we have anhedonia, loss of pleasure in previously pleasurable activities. Say before the city of the winning love, the patient loved watching cricket, playing cricket. Now he doesn't enjoy it at all. Things that used to manage and happy, do not manage and happy. And if it is about enjoy anything, it is for share you also develop. Lack of social interaction. Why are you stressed? Why do you guys give your friends? Because that is fun. If you're not enjoying it, probably you stop socializing. So it is a bit lack of social interaction. The favorable is affecting Latin. The term fate is used for emotionist. And it's learning is life. The patient is not any emotions, or feeling happy, or feeling excited. Lack of emotional response. Lack of emotional response, or restriction of emotional response. And finally, illuvia. Illuvia is decreased verbal output. So classically, about these symptoms as a negative symptoms. So last is because a volition. The depressive usually measure. Now, in many older patients who have depression, they may falsely derive the depression. And that is why it's called as pseudo-depression. Older patients who have depression may get the diagnosis of dementia. And that is why depression in older age is sometimes called as pseudo-depression. Why? Whenever a person is depressed, the cognitive probabilities, the thinking probability all gets slowed down. They get slowed down. And also, apart from slowing of cognition or cognitive processes, the depression also comes with the decreases in motivation. It don't feel like doing anything. But see what happens. Say you are conducting a test on a patient who is an older patient because of the ego specific dementia. Now he is not able to answer the questions because the cognitive processes are slowed down. Add to that, he does not have any motivation to answer it. Now say you start the treatment and the cognitive behavioral therapy or medications and the depression improves. Immediately answer will improve, motivation will improve. That is why you call this pure dementia. It's not realistic dementia. Just by improving the represented impulse, the cognitive functioning will improve. So the deficits are very relevant. If the patient priorities, which has become better, even if it is so better, if it is necessary ways, the low, the people become a person. So it is very interested response. Whereas in a protein dementia, the cognitive deficits are usually progressing, and in majority of the cases, irreversible also. So the answer is variable and inconsistent. With the responsibility for resting so of course, parasympathetic is a state procedure by family development by parasympathetic system, and in the resting state, parasympathetic system is dominant. Whereas sympathetic, as you know, is a fight or flight response. Where you are under some kind of stress or when there is a danger, just in parasympathetic system, it is forward. And finally, the medical question, which of brain is responsible for vision? The answer is occipital. Occipital cortex is where the visual processing is. So these were the questions. Thank you.